Well, Dr. Byler, thank you for agreeing to talk to us today concerning your study on nocturia. But before we get too much into the weeds, I'm wondering if maybe you could just tell us what the definition of nocturia is, and then why should clinicians increase their focus on it?
Nocturia is characterized by the need to awaken one or more times a night to urinate. We generally say significant nocturia is two or more times because this has been shown to have more impact on patients' sleepiness and overall health. Despite its impact on quality of life and connections to other medical issues, many patients continue to ignore nocturia, as displayed in some of my introductory slides. There's often a year-plus delay in presentation and 2 years or more delay in treatment. So as clinicians, we have a role to intervene on this, and we can improve the quality of life of our patients. In addition, there are growing health concerns that nocturia may be a presenting sign of. For example, hypertension in the young African American population. This can be where we pick this up. The same way we would pick up a diabetes patient with frequency of urination, we could potentially pick up a hypertensive patient with nocturia. So I think that we should focus on it in terms of improving the health and quality of life of our patients. We know nocturia is a common problem. There have been multiple studies, including aging studies, that showed estimated 28 million adults will suffer from significant nocturia. For the purposes of this lecture, significant nocturia is defined as over 2 times per night. This has profound effects on patients' wakefulness, their ability to work, and their calling out of work. So this has profound effect on productivity loss. So it was projected to cost over $61 million in 2008. It also has a growing body of health-related concerns associated with it. This is a study that was done earlier, 2017, where they looked at 8,600 patients, 5,200 of which completed the survey. This was an observational sectional survey of physicians and patients reporting urinary symptoms. And the main highlight I want to point from this study is that on every realm, as you can see on this graph, nighttime symptoms were significantly higher and reported as being more bothersome to patients' quality of life. So just from a quality of life standpoint, nocturia has a significant impact. They actually followed this study up with continued observation and looking at what was the delay and the barriers to care of nocturia. As you can see, the findings of their study were, on average, patients waited almost 1 year prior to even presenting to a physician. So they had dealt with symptoms for an average of 50 weeks before even coming. In addition, once they were seen, they've received their first treatment on average 106 weeks after symptoms start. So this is a 2-year delay now. So these patients have been dealing with their symptomology for almost 2 years without any kind of treatment. In terms of assessment, the physicians rarely used any kind of voiding diary, which we'll discuss later is paramount in discovering nocturia and its causes. And finally, despite symptom-based therapy, 59% of patients that were male still received an alpha blocker, and 76% received an anticholinergic. So there was really nothing specifically geared towards the cause of their nocturia. It was random assigned medication. As I alluded to earlier, there are multiple conditions associated with nocturia in adults. Increased correlation we've seen with depression, falls, including fractures, and mortality. Decreased correlation, which we discussed previously, was related to health, quality of life, and work productivity. And finally, there's a growing number of disease states that are brought on, and nocturia is a major symptom of them, including endocrinologic disorder, volume overload, obstructive sleep apnea, and bladder activity problems. Along these lines, a recent publication from the American Heart Association looked at a cross-sectional analysis of men with hypertension between the ages 35 and 49. When comparing hypertension to normotensive men, 56% more likely to experience significant nocturia if they were hypertensive. In addition, untreated hypertension was 39% more likely to report nocturia than controlled hypertension. So their conclusion was that uncontrolled hypertension was an independent determinant of clinically significant nocturia. And this kind of works both ways. In other words, if we're seeing a patient with nocturia, they may really have underlying disease, in this case, hypertension, but there's multiple concerns. So with this backdrop, we decided to look at what's the prevalence of nocturia in U.S. women and try to determine how often this was really happening and identify factors associated with significant nocturia. To do this, we used the National Health and Nutrition Examination Survey, or NHANES. This is a program run through the CDC designed to assess the health and nutritional status of adults and children in the United States. This interview includes demographic, socioeconomic, dietary, and health-related questions that are used in conjunction with a physical examination and laboratory examination to capture a snapshot of the health of the population. We looked at this database between the years of 2009 and 2014, mainly focusing on the question, how many times at night do you urinate? Now, this is self-reported with associated biases, but we assume that most patients would answer accurately to themselves. And we did a multivariable logistic regression based on that. Just for demographics, this is the age distribution of the women that were included in this study. As you can see, for the most part, they're pretty much the same until you get into the older ages, which is expected. When we looked at number of times per night these women experienced nocturia, 70% of these women experienced some nocturia, but even including like 1 or 2 times. Significant nocturia was reported in 28% of these women with a tight confidence interval. So roughly 1/3 of women are experiencing significant nocturia on a nightly basis. Just for comparison, we compared this to the same cohort in men. The males reported 62% of nocturia versus the female 69%. And as you can see, each age broken down here, in almost every age, the women actually reported more than the men, which was surprising. When we looked at age and its impact on nocturia, we saw a linear relationship, which is not unexpected. We know that there's a large component of age that affects urinary symptoms and nocturia. And this was congruent between the any nocturia group and the significant nocturia group for each age cohort. We then did a multivariable analysis looking at common things that would be associated with urinary dysfunction. These are the things that came out as significant. What I want to draw your attention to is urge incontinence. This is something that we could easily elicit in a clinical setting, and the factors that were not associated. So every female gynecologic or obstetric concern that we put in fell out. So it appears that the female nocturia is not related to obstetric or gynecologic concern. We then chose a list of 7 common medical comorbidities. We chose this list based on a prior NHANES paper looking at the prevalence of these issues. So we wanted to see, is nocturia prevalent in very common medical issues? Do they correlate directly? And we found that 3 of them did. Not surprisingly, hypertension was significant, arthritis, and depression. So in terms of reviewing the results, nocturia is common in U.S. women. It affects about 70% of the population, with 28% reporting significant nocturia. Consistent with other studies, depression and hypertension and arthritis correlate directly with the risk of this, as well as age. Interestingly, obstetrical factors did not play a role whatsoever. Although they have large impact on female voiding dysfunction as a whole, they did not appear to influence nocturia. And urge incontinence and poor health status is directly correlated. So in conclusion, nocturia is prevalent in U.S. women. There's growing evidence to suggest that nocturia will correlate with many other issues, and it may even be something that we can pick up in a clinical examination. And clinicians should remember to inquire about nocturia when examining women.
So, maybe you could explain your study to the viewing audience. What is it about?
In our study, we examined the epidemiology of nocturia using a cross-sectional U.S. population-based survey, NHANES. The National Health and Examination Survey is collected annually by the CDC and is designed to represent a snapshot of the U.S. population. We elected to focus on females, specifically to highlight the need for increased awareness and discussion about female nocturia. Although female continence is often discussed and published, we did not find as much about female nocturia. There's a growing body of literature to suggest health consequences and quality of life concerns that nocturia can be remedied and treat. So we felt it was important to show the female side of this. Other studies have examined female nocturia, but the NHANES database is unique to the U.S. as a snapshot and has less biases in that respect. As can be seen from this, female nocturia was just as, if not more prevalent than male nocturia.
What are some of the leading etiologies and distinct pathophysiologies driving nocturia?
Unlike some of the other lower urinary tract symptoms, nocturia is known to be multifactorial and often does not have a urologic basis. Common urologic conditions such as overactive bladder, enlarged prostate, or neurogenic bladder can have nocturia associated. In fact, many patients come to clinical awareness based on the bothersome value of nocturia as opposed to the other urinary symptoms that these urologic conditions can represent. And nocturia is consistently rated as the most bothersome urinary complaint. Despite this, many other medical conditions relate to nocturia. Any condition that will cause leg swelling and peripheral edema will lead to nocturnal episodes of urination. As patients lie down, the fluid from the legs is resorbed and acts essentially like a bolus of fluid at night. This is characteristic of congestive heart failure, liver failure, and some nephrotic syndromes. Another large culprit is obstructive sleep apnea. This causes partial or complete airway obstruction, leading to increases in intrathoracic pressure. This in turn increases venous return, distending the right atrium and inducing the release of atrial natriuretic peptide. This will lead to urine production. Other conditions that lead to urine at night is diabetes, hypoalbuminemia, depression, and polydipsia. Many pathways lead to nocturia, so it's not surprising that it's so common. We might lose sight of the widespread effects and causative factors that lead to nocturia in our routine clinical examinations.
How does nocturia impact the quality of life and the overall health of our patients?
Nocturia, or specifically significant nocturia, can have profound effects on quality of life. As previously mentioned, waking up at night several times can lead to a feeling of tiredness, calling out of work, and overall loss of productivity. In 2008, it was projected to cost over $61 million due to productivity loss alone. Nocturia, whether it be the causative factor or a repercussion, has many health connections, as we've previously mentioned.
Some people have described a thing called catastrophic nocturia. That sounds odd. What is the risk of catastrophic events with nocturia?
There is a large amount of literature linking nocturia to serious patient outcomes. Many elderly whom have significant nocturia end up falling during the night as they get up multiple times. This leads to fractures, and fractures have had a very strong association with increased morbidity and mortality of elderly patients. There's also a strong connection with nocturia and clinical depression. Depression has multitude of effects on us as humans, but can lead to health neglect, even suicide. And this waking up over and over at night can not only be a sign of depression, but can also lead to this feeling of tiredness and unaccomplishment that can further depression. At least 2 studies have now connected nocturia with increased mortality. A sub-analysis of reduction by dutasteride of prostate cancer events, or the REDUCE trial, included 7,300 men specifically looking at nocturia. After controlling for all other variables, men reported 3 or more times per night were observed to have an independent risk of mortality with a hazard ratio of 1.7. In addition, this connection was previously seen using NHANES data in 2011.
What do you tell clinicians in terms of the evaluation of fluid shifts primarily from the lower extremities as factors in nocturia?
When patients are complaining of nocturia, it is paramount to examine the lower extremity. The presence of edema can be an easily treatable source of urination at night. Depending on the chronicity, this can be a great place for us to advocate for our patient and help them uncover underlying medical conditions, or simply recommend a primary care assessment. For those with known sources of edema, raising their legs several hours prior to bed has been shown to greatly help the diuresis prior to sleep. In addition, compression stockings can help reduce the swelling from forming. I generally advocate restriction of fluids 2 hours prior to bed. Obviously, treatment of any underlying medical issue that will reduce the edema would be important.
What parts of the medical history do you think are critical when evaluating nocturia?
As with all medical conditions, it's important to know a patient history and other comorbid conditions. With nocturia, this is particularly important given its multifactorial etiology. It's important to know the presence of sleep apnea or risk factors for it, obesity, reported snoring, excessive daytime sleepiness, as this has a very treatable and easy effect on nocturia. Any cardiopulmonary condition, particularly CHF, COPD, essentially anything that will lead to accumulation of fluid or excess coughing, will lead to peripheral edema and should be sought out. Diabetes mellitus, multiple sclerosis, or lifestyle circumstances, alcohol intake, caffeine intake, have all been implicated. Although the data is mixed on this, in my practice, I've clearly seen that these are motivators of nocturia, and if patients cut out alcohol and or caffeine, they have improvement. Multiple medical therapies can lead to nocturia, namely diuretics, especially taken at night, dilantin, or lithium. And I'd like to point out this study on black males again with hypertension. This is a very treatable source of nocturia that reduced it in their study.
Are there any particular useful tools in your practice that you use to measure or diagnose nocturia?
An easy to do and commonly overlooked tool in assessment is a voiding diary or frequency volume chart. Using this, patients record each void with volume during the day along with intake of fluids and medications. They record each void after going to sleep and the volume they voided. In my prior reference work, physicians rarely used voiding diaries, which is truly a shame in nocturia, as it can really show the trends. Using these frequency volume charts, trends become very clear and easy solutions to nocturia become evident. For example, a patient with a reduced maximum void or bladder capacity will stand out. They may be treated by things to increase their capacity. The trend for a nighttime problem or 24-hour problem will guide evaluation. Consider a specific medical concerns that may contribute to a daytime symptom versus a nighttime symptom. For example, if a diuretic is taken prior to bed with a nighttime only problem, a solution may be as simple as moving the time of administration of the medication. Elevating legs with edema, as I mentioned, prior to bed will help diurese some of that fluid off. When using the frequency volume chart, one should at least notice the differences between day and nighttime voiding. This is paramount in showing etiologies that span time versus one that's only active at night.
Greg, I think that's it.
On behalf of my co-authors, Dr. Ginsberg and Dr. Doherty, I'd like to thank Dr. McVary for this opportunity to present our data and discuss nocturia.